PJUSD is open for full in-person learning for the 2021-22 school year, and we are looking forward to being back on campus. To keep everyone as safe and healthy as possible while on campus and at home, we will review some important health and safety information. On July 12th, the California Department of Public Health published updated guidance. The founding principle of this guidance is that all students must have access to safe and full in-person instruction at the onset of the school year, as well as minimizing missed school days. Health experts agree that layers of mitigation strategies are best practice to reduce the spread of illness, and recent evidence indicates that in-person instruction can occur safely without minimum physical distancing requirements when other mitigation strategies are followed. This means that we can return to full in-person learning safely by following these key practices. First, everyone is required to wear a face covering while on campus unless they have a face mask exemption on file. Students will eat outdoors. If the air quality or weather is bad, students will eat indoors with as much spacing as possible. Sites are prepared with improved ventilation, daily disinfecting routines, and personal protective supplies. We will review the importance of frequent and correct hand hygiene practices and cough etiquette, safety measures to be practiced at home and at school. Self-screening daily and staying home when you are ill is another important step to keeping everyone healthy. We will continue to track COVID-19 cases and work with the health department to recommend isolation and quarantine as needed. Lastly, we will review testing and vaccination recommendations as part of a multi-layered approach to stopping the spread of COVID-19. COVID-19 is caused by a virus that travels from person to person in respiratory droplets that fly from our mouths or noses when we talk, cough, sneeze, or exhale. For this reason, face coverings are an important way to protect yourself and others. All students and staff are expected to wear a face covering at all times. Face coverings can be removed for eating, but should always be carried so they can be put back on when needed. Face coverings must cover the nose, mouth, chin, and the sides of your face. The face covering cannot have a valve, which is a piece of plastic on the side of the mask that lets air out, because germs escape with the air. If your student cannot wear a face covering due to a documented health reason, please contact the school nurse immediately. Students may not share or swap face coverings with anyone else and should try to avoid adjusting their face covering. Teachers may provide students with a new face covering if theirs breaks or needs to be replaced. Additionally, face covering should be cleaned after 1 day of use.
It's important to wear cloth face coverings when you're out in public and around people who don't live in your household. Face coverings act as a barrier to help slow or reduce the spread of COVID-19. Check with your school for information on face covering policies. Wash your hands before putting on your face covering. Put it over your nose and mouth and secure it under your chin. Fit it snugly against the sides of your face, but make sure you can breathe easily. Don't put the face covering around your neck or on your forehead, and don't touch it. If you do, wash your hands. Never share or swap face coverings. When you get home, carefully take off your face covering by stretching the ear loops or untying the strings behind your head. Fold the outside corners together and put it aside for washing. Then wash your hands. Cloth face coverings should be washed and dried after use each day. Label your face covering with your name or initials. Bring a backup in case it's needed. In addition to wearing cloth face coverings, remember to follow everyday healthy habits. Wash your hands often, stay 6 feet away from others, and stay home if you're sick. If you have any questions about wearing a face covering at school, contact your school nurse, a trusted resource for students, parents, and staff.
There have been a lot of questions about where lunch or snack breaks should be taken. Students will wash hands and eat outdoors unless there is poor air quality or very bad weather. Masks will be removed for eating, so schools are working on bringing in extra lunch tables to allow more space between students. Students should not share food. If students must eat indoors, you may eat in smaller groups or in your classroom. If eating inside, doors and windows may be closed with air filters running or may be open to allow for more airflow. In addition to paying close attention to health conditions in the community and following the health department's guidance, school sites are prepared for a full return to campus. This includes personal protective equipment such as masks, face shields, and gloves for staff and students. We have hand sanitizer available in all classrooms and portable hand washing stations at every school. Ventilation has been improved with MERV 13 high-grade air filters in all classrooms and portable air purifiers in each room. Signage is posted on campus to remind students and staff of the need to wear a face covering, practice frequent hand washing, cough etiquette, and stay home when sick. We will continue with enhanced cleaning measures, including daily disinfection of all rooms used by staff and students. We have all heard of the importance of washing our hands. COVID-19 may be transmitted when a person touches a contaminated object and then touches their eyes, nose, or mouth. Hand washing is one of the best ways to prevent the spread of germs. So let's review how and when to wash hands.
Washing your hands is easy, and it's one of the most effective ways to prevent the spread of germs. Wet your hands with clean running water. It can be warm or cold, and apply soap. Lather your hands by rubbing them together with the soap. Wash the fronts and backs, wrists, between your fingers, and under your nails. Scrub your hands for at least 20 seconds. You can sing the ABC song once, or the Happy Birthday song twice. Rinse your hands well under running water and then dry them with a clean towel, or air dry them. Turn off the faucet with a towel. If soap and water aren't available, use an alcohol-based hand sanitizer that contains at least 60% alcohol. Apply the sanitizer and rub your hands together until they're dry. This should take about 20 seconds. Wash your hands before you eat or touch your face. And after you use the restroom, go outside, blow your nose, cough or sneeze, or touch your face covering. Remember to follow everyday healthy habits. Wear a cloth face covering, stay 6 feet away from others, and stay home if you're sick. If you have any questions, contact your school nurse, working on the front lines of the COVID-19 pandemic in schools.
Washing hands with soap and water gets rid of the germs by breaking down the parts of the virus and rinsing them off your skin. When at school, students must wash hands with soap and water before eating, after using the restroom, and when hands are visibly dirty. Hand sanitizer works by killing the germs on your hands. It is diluted by dirt, grime, or liquid on the hands, which is why hand sanitizer doesn't work well on wet or visibly dirty hands. It's important to clean your hands every day before leaving for school and upon arriving home from school. Students will also need to either wash or use hand sanitizer when they enter and leave a classroom, after blowing their nose, coughing, or sneezing, before and after touching their face or face covering, and when instructed by a teacher or staff member. Students will have access to sinks and portable hand washing stations when on campus. Students will also have access to hand sanitizer in classrooms, the office, the multipurpose room, and the gym. Students should let a staff member know if the hand sanitizer, soap, or paper towels are getting low or run out. Coronavirus spreads when droplets from our noses and mouths hit another person's nose, mouth, or eyes. Please protect those around you by covering your mouth and nose when you cough or sneeze. Avoid spitting in public and blow your nose into a tissue. Then wash your hands. Here's a funny video to reinforce the do's and don'ts of coughing, sneezing, and spitting, produced by Digital Medic at Stanford University. Everyone is expected to screen themselves for illness before leaving the house each day. Anyone experiencing a new symptom of illness is expected to stay home, even if they are fully vaccinated, because immunized people may still transmit the virus. The district will enforce a 10-day isolation requirement for anyone with a positive COVID-19 test result. A person with symptoms of COVID-19 who does not get tested will be presumed positive and required to stay home from school for 10 days. More information about isolation guidelines can be found on the district's COVID-19 Healthy Campuses website. Sometimes people start to feel sick when they are already at school. If a student starts to feel sick when at school, they should let the teacher know. The teacher will give the student a new paper mask to put on over their face covering, send the student to the health isolation area, and let the office know. Once at the health isolation area, the student will be assessed and have their temperature taken. If illness is suspected, the office will call the student's family or emergency contact to pick up the student from school. A family member or emergency contact will be expected to pick the student up promptly if called due to student illness. Hi, I'm Nurse Amy. Let's talk about how to screen yourself for illness before coming to school each day. As you probably already know, COVID-19 causes symptoms like fever, chills, cough, body aches, shortness of breath, sore throat, sudden loss of taste or smell, diarrhea, nausea or vomiting, fatigue, headache, nasal congestion, runny nose, or poor appetite. It's important to self-screen for symptoms every day before leaving home. This checklist provided by the district covers risk factors and has instructions on what to do if you have been exposed or if you might be sick. If you have had close contact with anyone diagnosed with COVID-19 within the last 14 days, check yes, that's a risk factor. Check in with yourself. Have you had any of these symptoms in the last 72 hours? If so, check yes. And finally, take your temperature. A fever is usually a temperature of 100 degrees or greater. It's a sign the body is fighting off an illness, but sick people may not always have a high temperature. If you look pale, flushed, or sweaty, or if you feel tired or weak, these can be signs of illness. Scientists have found kids and teens can be infected with COVID-19 and contagious, but may not show any symptoms or may have very mild symptoms that can feel like a cold or the flu. They may not have a fever. Some only have stomach problems. If you don't feel well, you should stay home, rest, and watch for new or worsening symptoms. Your parent or guardian should report your absence to the school and call your doctor. COVID-19 may not be the cause, but it's better to be safe than sorry. So, what if you have seasonal allergies or asthma? If you have allergies or asthma, some of the symptoms are similar to those of COVID-19, but allergies and asthma are not contagious and it's okay to go to school. Please make sure the school nurse knows you have allergies or asthma. Manage your symptoms with maintenance medicine, and if you have an emergency inhaler, please carry it at school. Any student who has symptoms at school may be screened for COVID-19. The student will be allowed to rest for at least 10 minutes, and if symptoms don't improve, the student will go home from school. The school nurse will follow up with the family and public health to provide support and information. Let's review. If you stay home sick, your family should report symptoms to the attendance secretary and call your doctor for guidance. You should not return to school until you've been fever-free without the use of fever-reducing medicine for 72 hours. That is 3 days at home without a fever, because even after a fever is gone, you can still infect others, especially when coughing, sneezing, or blowing your nose. Taking care of yourself by self-screening every day and staying home from school if you don't feel well helps everyone stay healthy. Thanks for watching and see you at school. As part of a robust contact tracing and case investigation program to keep students, families, and staff as safe and healthy as possible, we are requesting that families and staff report all potential cases of COVID-19 to the district using the COVID-19 reporting at djusd.net email address. This includes staff or student exposure to a positive or probable case. When in doubt, report. A district nurse will contact the reporter and provide education and guidance on health issues and protocols. The district nurse will also notify Yolo County Public Health of positive or probable cases of COVID-19. The district nurses will work to determine who in the school has potentially been exposed and help quarantined or isolated individuals and or families on a plan for return to school. The district works closely with Yolo County Public Health to quarantine exposed individuals or classes as needed and communicate with affected students, staff, and families. Testing is an important way to keep your friends and family safer and healthier. For any new symptom of COVID-19, get tested through your healthcare provider or through the Healthy Davis Together free testing program. If you have symptoms, testing is recommended for vaccinated and unvaccinated individuals. DJUSD, in conjunction with Healthy Davis Together, also provide testing for students with new symptoms of COVID-19 at most school sites. The district works closely with Healthy Davis Together to provide weekly asymptomatic testing for all students and staff without symptoms of illness. Weekly testing is strongly recommended for all staff and students, but is especially important for unvaccinated individuals. For more information about testing site schedules, visit the DJUSD COVID-19 website under Healthy Campuses and COVID-19 Testing. Vaccination against COVID-19 is safe and effective. It helps prevent the spread of illness and reduces the severity for those who are vaccinated, reducing hospitalizations and deaths due to COVID-19. Currently, a vaccine is approved for people 12 years and older. If a student is vaccinated, please provide a copy of the vaccination card to the school office. Providing proof of vaccination to your school office may keep you from potential quarantine due to exposure. Thank you for helping keep everyone as safe and healthy as possible as we return to campus for the 2021-22 school year. For more information regarding current policies and practices, visit the DJUSD COVID-19 website. And check the Healthy Behavior site for health and safety training videos, as well as the Healthy Campuses site for the most current reporting, contact tracing, isolation, and quarantine practices. Please contact your school nurse if you have any questions about this training or COVID-19 health and safety protocols. Thank you.